Hello, welcome to Backstory with Joan Goldstein. I'm Joan Goldstein. I have a guest today who is one of the most important men in our community. His name is Jeff Grosser, and Jeff Grosser is the Princeton Deputy Administrator for Health and Community Services. And one of the problems that he has been helping us with and working on for these 2 years has been the effect of the COVID epidemic on our community and how we need to respond to it. So Jeff, you recently pointed out that things are going to change again, right? How are they going to change?
That's right, Joan, and thanks for having me this afternoon. The one thing with the pandemic that we've noticed throughout the course of the last 2 years is that it's going to change. We've been through surges in cases, we've been through vaccination endeavors, and we've been through return to work, return to school. Really what's next for the community with the pandemic is the return to what the community is going to look like, post-pandemic, which is living with COVID-19. Residents have been through a tremendous amount of difficulties throughout the last 2 years, which is no doubt, but we're really entering a phase of recovery for COVID-19. And that change is going to incorporate, try to break down some of the social isolation that we've seen throughout the course of the last 2 years.
Yes, and some of that social isolation we talked about. You said the schools are going to be open now, and children will be returning to the physical plant of the schools, and that started on Monday of this week, correct?
So yeah, the mask mandate from Governor Murphy ended on Monday. So if you think about it, that was a whole new phase of school. The schools have been in session since September, but under a tremendous amount of COVID protocols and various forms of guidance from both the state health department, our health department, and the Centers for Disease Control. This new phase of the school return incorporates masks being optional and getting people used to not wearing masks in crowded settings again, while still maintaining some of those pandemic precautions that we put in place before, like physical distancing, certain quarantine and isolation protocols, and contact tracing protocols that we've had in place all along. So for schools, you could almost say that as of Monday, some of those schools that went masks optional entered their own new phase of the pandemic, which is getting used to seeing each other's face again, which hopefully actually makes things a little bit easier for them throughout the rest of the school year.
Yes, but you also point out, you were interviewed in the Town Topics, and you also point out that things can change and that we will have to change as they change. Is that correct?
Yeah, absolutely, Joan. I mean, the point is that as a society, we went through so many breakdowns of social norms through this pandemic. We had to get used to wearing masks. As a society, that wasn't something that we were necessarily comfortable with. Some people still aren't. We had to get used to massive vaccination clinics again, getting people used to getting a shot to protect themselves, protecting each other. We had to get used to not seeing our family for fear of, spreading this novel coronavirus and not seeing them for holidays, which for many is something that was never done before. So, where we are now is at a point where with the pandemic that I feel like we're starting to revisit those things and having some of those memories of what's happened over the course of the last 2 years. It's really hard to believe that, Princeton saw its first case of COVID-19 almost to the day that we're meeting 2 years ago. So to think about the over 2,200 cases that we've investigated in the last 2 years, and then putting that together with, what the community's been through, sometimes is not an easy thing to wrap your head around, and certainly not always an easy thing to talk about. But the one thing that we've noticed, and I've spoken to this in the Town Topics, is that we've made significant changes through the pandemic, and I think as a community have done a great job mobilizing to protect our families and to protect each other, whether it be increased mask wearing, decrease in capacity in restaurants, eating outside. Those things are always going to be part of our public health precautions. And I think we need to be used to the fact that if we see a surge in cases, we might have to enable some of those precautions again.
Yes, so pretty much you see that it's planning, but planning very, very brief, not long range planning, because we never know what's going to come next, whether it's going to be a new brand of something or a surge in something, and we have to live with the unexpected. And that's not what we're normally used to.
No, oh, sorry,
Go ahead.
Joan. I was
Go
going to say,
ahead.
yeah, we're used to, constants. We're used to the normalcy in our lives. And I think when things like this change, it makes us anxious. And as a community, we all handle that individually differently. So we need to support one another because we're all going to feel things differently in that. I know Monday was a very, it's probably emotional day for a lot of schools because they're going back to something that they never thought that they were going to see probably in the course of the pandemic. And I think, again, that's okay. And I think that goes back to what you and I had spoken to a little bit about, Joan, which was the anxiety that comes with social isolation, the anxiety of feeling like you're by yourself. And as humans, we really feed off of those social interactions. So again, I think it's great to have this conversation because sometimes it's difficult to know where to start. And just like we're talking right now, we could talk about a lot of different things. So I appreciate you focusing this conversation because I could really go any way with it right now.
Wonderful, wonderful. I met with my sociology college students that I teach at the Lewis School in Princeton yesterday, and I asked them what they wanted to ask you. And they gave me their questions, and some of them said, how do you help children who've been trying to deal with isolation? That was one thing. Another said something about how to is there more violence amongst people, amongst and between people because of their isolation or because of things being so difficult? And those were the questions they gave me, so I'm giving them to you.
Yeah, they're very, very good questions. And
Yeah.
I've got 4 children of my own, and sometimes they ask me the best questions, and sometimes I just don't know the answer to. These 2 particular questions, I can start off by providing the guidance that I would provide to even my own family with regards to social isolation. If you feel as if you haven't been able to socialize in the last 2 years due to, again, the restrictions that were part of school or part of their community, the best thing you can do is, number one, if you can have a conversation with somebody you trust about that, maybe a mom or dad, a guardian, an aunt or uncle, grandparent, or a good friend, have a conversation about how maybe they could help you with that. But schools typically offer really good after-school programs, whether it be clubs or athletics. And sometimes those are the best social gatherings that you can have because there are people that have similar likes to what similar backgrounds or traits or likes that you may have. And sometimes those are easier people to connect with, at least to start. So that would be one of my first suggestions for how to kind of get back in the swing of things from a social perspective. But it's also completely fine to not be comfortable wanting to socialize after you've been, basically in isolation for so long. And again, what my best guidance would be, take it at your own pace and don't feel like you have to force anything at this point. If you feel like you don't want to socialize, you want to just go to school and have it at that, ease into it as you feel more comfortable. With regards about the question about violence, I think we've seen that throughout the rest of the country right now, that we're seeing certain acts of violence and even homicides and murders at a level not seen before. Some of this could certainly be tied back to the isolation that people have been through and the fact that they're basically coming out of isolation, they're frustrated or angry more so than regular. They don't know how to exhibit that in a more normal or healthy way. And it's coming out in the forms of violence, whether physical or verbal. So fortunately in Princeton, we have not been, as a public health department, as involved with that just because we've been so tied up with the communicable disease investigations and contact tracing. That would certainly be a good question for our police chief, Chief Morgan. But I can tell you that it's something that I know is going to be part of our COVID recovery planning at the health department to make sure that we're working closely with the police department and groups like Corner House Behavioral Health through some of these conversations.
Right. Yes, I believe I had some Corner House people on my show a couple of years back. Yes, very good. Well, so you say things are going to change. They are changing now, exactly. Is there anything that any of us can do for each other that might help?
Well, going back to what I mentioned, sometimes talking is the best thing you can do. Not internalizing too much of what you've been through, and not feeling like you're alone. And that is difficult. That's difficult to break out. It's easier said than done. And typically what happens is individuals look back upon really difficult times and say, you know, I should have just talked to somebody about what I was going through. And that first step is sometimes most difficult. You know, we all have people that are close to us in our lives, whether it be family or friends or even coworkers. Sometimes when you ask somebody how you're doing, it's more of a welcome or a greeting than anything. And I think now we need to reevaluate when you ask somebody how they're doing. Don't just accept a I'm fine or a I'm okay. You know, really ask them how they're doing and have a follow-up question, because the one thing that I've noticed in the community is that the concerns that we've heard from family members, residents, people that work here, people that study here, is that they're frustrated with the fact that they feel like 2 years have been lost in their lives, and they've missed out on things that otherwise would have happened to them, whether it be a wedding or somebody's birthday or even funerals. You know, there was a time where people were missing out on people's funerals because of restrictions that were happening with COVID. You know, talking about those things typically will help. Internalizing them is not something that we want the public to do. So we're trying to increase, the conversations in town about social isolation and how to break down some of those barriers. One of our most socially isolated groups in Princeton was our older population, whether it was individuals that are widowed, individuals that have family that live far away. And we're trying to break down those barriers by operating watercoloring classes that are done by the Princeton Arts Council. And it's a free watercoloring class that we're operating through the health department. And we're trying to get people to come out and paint with other people and learn something that either is new or something they love to do, but they're able to do it with one another. So we're trying to increase opportunities for people to socially connect in town, and whether or not they want to, we're hopeful that at least we'll offer something that they want to do, and whether or not they want to talk to somebody is a different story, but we'll try to get that out of them too, because we know that people have really been trying to understand what has happened in the last 2 years. And as you mentioned, Joan, it may or may not come back. We may have things we have to put back in place. And I just don't want that to be a trigger for anybody that's not used to or not wanting to go back to what we had to go through before.
Yes, what do you think is most difficult for people? That seem to be most difficult for them to deal with? Is it wearing a mask? You know, why is there such a strong resentment towards mask wearing?
It's a great question. In different parts of the country, it might be answered differently. In Princeton, I can't explain how proud I am of the community in terms of the ability to, mask up and not think about it as a detriment to their own freedom. And I think that's where I think some of the national narrative came from. It had a lot to do with their own personal rights and from a parenting perspective, the fact that the parent should know what the child should be doing and how to protect the child. In Princeton, it never really came down to that. We had businesses that were supportive of it even before it was a mandate. We had the school, our public school district and private schools were going to do whatever it took to keep the children safe. So their mask guidance was always, kind of a step above where the CDC and even the Department of Health was. But I think in general, what scared people the most was this fear of the unknown. So much was being learned each day about COVID-19, whether it was long-lasting impacts from it, from a health perspective, or it was the inability to see family members and loved ones, and the inability to travel. I mean, some people utilize travel as an escape, and it's a hobby, and they weren't able to do that either. So, it was really the fear of the unknown when it came to what was next with COVID-19, kind of as we've been talking about this whole time. The precautions that were put in place from a public health perspective in town never really seemed to be a hurdle that Princeton had a hard time getting over. And that made my job significantly easier as a health officer. What was difficult was determining when we were going to start de-escalating some of these precautions, because when do you know, as a health officer, it's the most difficult thing to say when something is safe. We can say when something is safer, but to say it's safe is very, very difficult. So I think that too was part of the residents' concern over, when am I able to take my mask off? When can I go to a restaurant? When can I go to a concert? Those are all questions we've all asked, and we all judge that risk differently.
Mm-hmm. Yeah, I was invited to something that I didn't want to go to because I would have been in a room full of people, and I was being very protective of myself. Yeah, and I had the public health background to realize I had to respect those rules. Yes. Well, there was something else that came up. There was an uptick in the number of cases at Princeton University. What's going on there, and what can they do?
That's correct. Yeah, and again, Princeton University, they have their own health services department. They have an environmental health and safety department. Much of what we do for the community, they do on campus for their own undergraduate students or graduate students and their faculty. So we operate as basically the liaison, the governmental liaison from a public health capacity. And also we will interact with the university and then bring those concerns to the New Jersey State Health Department as well. The university itself, when they have an outbreak, they investigate cases. They traditionally will do a lot of the contact tracing and case investigations themselves. And then we will follow up if in fact it's an outbreak that's sizable. So the current outbreak that you were talking about, we've been working with the university officials over the course of the past few weeks. That outbreak was really tied to what, as a community, we talk about the changes occurring. We're really tied to social gatherings that came about. Mask wearing was being, the restrictions were being lifted. Capacity restrictions for certain buildings were being lifted, and social gatherings were on the uptick. And on college campuses, we're kind of used to that. In the springtime, as the winter starts to fade, spring events come about, spring formals, barbecues, things like that. And whenever you have those opportunities for disease transmission, particularly at the tail end of a surge, you're bound to have what we call in epidemiology propagated outbreaks. So you'll have an outbreak in one venue that leads to an outbreak in another venue, leads to an outbreak in another venue, and it doesn't stop until you stop those individuals going to another location, starting another outbreak. So that's kind of what happened on campus. And again, the university's been really great about communicating those cases and working through those outbreaks. What we've seen with Omicron variant of COVID-19 is that it spreads so quickly that by the time you identify an outbreak, there's already a couple more that are, so to speak, logs burning on a fire. They're already in the works. So until you notice those outbreaks and piece them together epidemiologically, you're going to have a few more cases before you can start to slow it down. The good news is those cases have started to slow down now that they've recognized that.
Oh, good. That's good news. Okay, that's part of, I think it's the ups and downs of this COVID that is what is kind of difficult for all of us to live with, isn't it? And you're trying to help us, but you also have to be on top of the changes, and they're going on and off and on and off.
Yeah.
So you, as you said to me in our conversation, you can't plan very far ahead, because things keep changing.
Yeah, we always say public health is a marathon. And when you're running a marathon, you have to think in the now, but you also have to think about that next mile to make sure you've got enough juice in the tank to get there. With the pandemic, it's pretty similar to that. The problem is during a pandemic, there's not a lot of time to rest and a lot of time to basically recover. Because in the times that you're in those the low points of disease transmission, that's typically when you're trying to recover, but at the same time, you're trying to get ready whenever that next surge does take place. And as a health department, we're used to that for endemic diseases like Lyme disease and flu. But on this scale, Joan, I think that's the part where the public health system as a whole was tried. Our workforces have traditionally been very low, resources have been low for public health, across the board. And I think that was what was tried throughout the course of the last 2 years, while trying to manage a pandemic, but also trying to manage your workforce to make sure that you have enough people to be able to do the job that needs to get done. That has been something that, while we're caring for the community, we're also trying to care for our staff here that are doing the job of public health officials.
Is there anything that we and the citizens of the community can do to help in any way that we can be of assistance?
I appreciate that. I appreciate that question. As a whole, like I mentioned before, the residents have been very gracious with accepting new guidance and not pushing back much. There's been other parts of the country where health officers and public health departments have had resignations over the fact that there's been so much pushback over guidance. Not here. Princeton residents, like I said, have been really gracious with accepting new guidance and even pushing guidance where they might want extra guidance. We work through being a little bit more cautious in certain facilities and organizations. But as a whole, I think it does come down to, many times through budget hearings and when we talk about the health department and what the future holds, health should be at the table. Traditionally, law enforcement, first responders have always been, they need to get the certain tools to make sure they can get their job done. And public health should be right there with them. We should, as public health professionals, be considered first responders, should be considered right up there with law enforcement, fire, first aid, and public health should be in there too. Because at the end of the day, back in March of 2020, when the municipal building shut down, the health department and the employees here were still coming into the building and did so right up until when staff returned nearly a year later. So in my book, that's being a first responder. And I think, the resources that we need are typically surrounding staffing. You need staff to be able to do outreach to the community. You need staff at vaccination clinics. You need staff to contact trace, to do case investigations. So traditionally, we try to evaluate our workforce every year. And with the pandemic, obviously, there's been this surge of a need, but we need to make sure that we're ready for really anything that comes. And back to your original point, how do you stay ready for things down the road that could happen, that could be drastically different or worse than now? And I think the answer to that is be ready to change and, make sure that you have leaders in place that are supportive, which we do. We hired a full-time public health nurse a few months after the pandemic started purposely to assist us at vaccination clinics, even though we didn't have a vaccine yet. So having those leaders in place is a huge help to our department here in Princeton.
So really, it's about the community.
Yes. Yeah. Public health is community health. Yeah. Exactly.
Yes, I agree with you 100%. Well, you're doing a wonderful job. We are so fortunate to have you here and to be doing what you're doing, because you not only understand the problem, you are able to take action and figure out what comes next. And even though things are going to change and change and change, you're on top of it. And you are the gift to Princeton community. And I'm so glad that you are our Deputy Administrator for Health and Community Services. And Jeff Grosser, let me thank you so much for being who you are and contributing, and for being on my show, Backstory with Joan Goldstein. And
Joan, it was a pleasure talking to you.
I hope you'll come back. We'll talk and catch up next time and see what's changed.
That sounds like a plan.
It does. It certainly does. Thanks so much, Jeff Grosser.
Thank you, Joan.
Thank you for coming to Backstory with Joan Goldstein. Goodbye.